Thank you, TY. So now that we know about the opinions from healthcare practitioners, we also want to know, what do patients think about electronic product information? Hello, my name is Hannes Jarke. I'm a project coordinator at the European Patients Forum. And for this project, we integrated the opinions and the feedback from 8 individual patients across the development process of the EPI app. So we had 8 people from different countries affected by different diseases and across different age groups who gave their feedback on the development of the app. So we wanted to make sure to take patient feedback into account at a point where change is still possible. Over the course of 5 weeks, we had 4 workshops, where the first one was concerned with the discovery. So how do patients actually interact with the already available paper leaflets? The second day was an ideation, where together with patients, we developed ideas and key features for an e-leaflet. On the third day, we looked at a prototype of ideas and features. So patients had the opportunity to give feedback on the first draft, so to speak, of the app. And on the fourth day, we had the prototype validation, where we looked, did this app actually meet the expectations and the ideas that patients shared in the previous days? But let's not hear me too much. Let's hear directly from the patients. Let's talk to the patient advisors who have been part of PharmaLedger and the workshop series on electronic product information. I'm really glad to introduce you to Silvia Scalabrini, Marta Morato, and Robert Joyce. And we will ask them how it was during all of those 4 workshops over 5 weeks. And my first question would be to Silvia, and I would like to know, of these workshops, which were the most important aspects for you and the other patients who has participated? What were the key takeaways? What should be included in such an EPI app?
Thanks, Hannes. So if I look back at the workshops that we had with the other members of the user advisory groups, as well as with the professionals involved, there are actually quite a few learning points that I'd like to share with you all. So the user advisory group included people from a wide range of age, conditions, countries, and also backgrounds and cultural differences. However, we realized pretty quickly that we all interacted with the leaflet in various ways. So ranging from, for example, deep engagement to actually expressing trust in the healthcare professional as a way to feel sufficiently reassured in taking the medicine. So that was also very interesting starting point for all of us. But despite this diversity, despite these differences in thinking, we realized that we had some common grounds. And we all wanted really just to pitch the emphasis on the importance of accessibility. So accessibility is a key aspect of all the information included in the leaflet. Whether that is paper-based or also all the electronic product information. So accessibility really have a leaflet that is easy to consume, that has user-friendly information, that's easy to understand. That was really considered for all of us as the key aspect. So that was really the common thing upon which we built then the rest of the workshops. One of the other features that we felt was also important to have was related to the latest and up-to-date information about the medicine. And that should definitely also be included as a reliable source of information for all the people accessing it. We also felt the need to actually have some information about the side effects of the medicine, as well as the interactions with other medications. So really just to make sure that people could have clear information about how to take the drug safely. So safely was really a key aspect of the information provided. And we also felt that although we had different opinions at the beginning, but that's the power of diversity really. And at the end, we managed to reconcile our views, and we all felt the need to have a search function in the app. So for specific terms, or just maybe in order to retrieve information quite easily. And lastly, we also felt the need to have a way to report and document side effects in relation to the medicine concerned. So despite the rich conversation and rich discussions that we had throughout the workshops, we also realized that, however, the electronic product information should not completely replace the paper leaflet, so that at the beginning we could actually start with having both of them together. And because it would also be an important step really to get people to get used to it, but also in terms of making sure that the different contexts and societies really could make adjustments digitally, and that people really could be put in a position to feel empowered to access the leaflet and the information in a safe way, in a way that made them feel comfortable about using the medicine. So this, in a nutshell, really were the key features that we felt that the electronic product information app should include. Of course, we were also explained very clearly in a very, very transparent way that there are also some legal requirements and principles that companies have to comply with, and therefore these leaflets must comply with principles, and they have to also make sure that they reflect what the law is saying. So there is not always room for flexibility in the type of information included, but also in the way it is actually phrased. So as I say, we were made aware of it, we were clearly explained the process, and I think that as a last point, I would really like to stress the importance of this, because this was a really good way for all of us to actually establish trust with the professionals, with the people involved in the workshop. And as a last very important learning point and takeaway, I just like to emphasize the importance of keeping honest communication flowing among all the stakeholders involved. That really helps to manage expectations from both sides, but also really to cement some really strong trust in each other that then allow some long-lasting collaboration. And I do feel that we did achieve that throughout the workshops.
Thank you so much, Sylvia. So you already touched upon a few very, very important points, which are relating to trust and which are relating to how to involve patients in a very good way and in a beneficial way. So I was wondering, and I would like to ask Marta about this topic. Would you say that patients were included in a good way, and or as you've expected? And was there something special about the series of workshops that set it apart from others?
Hi, Hans. Thank you very much. Well, first of all, I think that it's not very usual that patients were included in some very important projects, especially the beginning steps, because patients will have the really knowledge and our really day-to-day and our needed, our real needs that we have to have the support, the real support, in order to make sure that our quality of life is the best as possible. So it's very important to be included in this kind of projects. And thanks for Pharma because we have been included. And it was a really extraordinary opportunity to show them how is our daily day, what are our needs, what are our expectations about the health authorities or the healthcare systems, or all the information that we need. And it's very important to make sure that our quality of life is as better as possible. And I would like to point out the really, really fantastic way that the workshops were run in order to ensure that all the patients and all the members, we had the chance to express our needs and our opinions, and especially that the respect, the empathy, the really very good environment, and but the most important is the team feeling that we are we were working all together for the same objective, which includes the patients. I think that the best word is to say that the collaboration. I think this was the best word to define this kind of workshops, because we have the common purpose and the collaboration. It was the main aim for all the members. Related to the APP tool, as a patients altogether, we have the chance and the opportunity to express our concerns, our features related to the tools that we have right now in order to compare with a potential tool that we will have in the future. And especially, as Silvia said, and Silvia explained really well that which are the main topics that the patients would like to have really clear in order to make sure that the information is updated and is available. And also, I think that as a group, I think that the leaders of this project have really listened at us in order to take into account our opinion, and in the fact they show us a preliminary ABP project in which include all our comments, and not at all. It means that they will assure that in the future they will show us a new prototype in order to make sure that all of our concerns have been included. So it's really important as a patient in order to be sure that our comments are really taken into account. That not always happens. It's very important. In another side, as Silvia said, that sometimes we made a lot of proposals, but the legal requirements didn't allow to go ahead with our proposals or our need. But our main is to work together and especially to collaborate in a friendly way in order to how to achieve some changes to be sure that the patients really have that we all need in order to make sure that this ABP is really adapted to patients' needs.
Thank you so much, Marta. Okay, and then lastly, what I would like to know is, during this session of webinars, this session of workshops that we've conducted with all of you, and we've heard already the main takeaways and we've heard the positive things about it. But Robert, I was wondering, are there any things in the workshop series that you thought were maybe missing, or anything that could have been improved, anything that could have added even more from a patient's perspective to this series of workshops?
It's very interesting because I've been involved with several different projects over the last couple of years, particularly over the pandemic, that have involved patients being involved in co-production. And in this particular project, PharmaLedger, we entered into the project kind of like the midway point of the project. And I think this was a pity because as patients, as public involved in this, if we were involved from the very beginning, as the project started, I think there are a lot of things that we could have done to help contribute to how the project has been developed. There are a number of things that we could do in this early engagement process. We could be streamlining exactly what is required by the patients for PharmaLedger. And by doing that, we would have helped to shape how the project would develop from a very early stage. My experience of PPI has changed projects that I've been involved with when I got involved at the very start. For example, there was an app that we were developing, and the contribution that I made helped the developers develop the app so that it was user-friendly from the very beginning. And the developers found it much easier to write the software and to create the code that was necessary because they knew what the patient needed, and it helped to streamline the process. And I think PharmaLedger missed out on an opportunity to do this in this particular project. However, it's not all bad. PharmaLedger actually reacted when we became involved with this project. And I think once the team felt the passion and the desire that patients have to make this project a reality and make it suitable for patients, the dynamic changed. They realized that we actually could be valuable contributors to the project, making it more successful. And I have to admire the team, because once they saw the way that we were wanting to be engaged, they decided to change. They adapted the PharmaLedger project to get us more involved. Look at this. We're actually helping to share our experience. And we've been involved with other dissemination projects or webinars to share our experience of the PharmaLedger project. And I think that has come about because the team, the whole PharmaLedger consortium, realized that patients are an asset. We can actually contribute to the project and actually make it more suitable. And it's easier for the general public to understand a project like this when it's people who need it as patients describing what it does. And I think that's really how using patients all the time throughout the project, from the very beginning to the very end, we can help to shape the project. But also my hope is that us being involved continuously will help with the acceptance of the project and make it more valuable. One of the things that I have found is that when patients realize that patients are involved, they trust the project more. And that's because one of their own family, one of their own community is involved in the project. And I have to admire PharmaLedger for adapting what they did, bringing us in and allowing us to share our experience of the project and shape it for the future. Absolutely fantastic. They missed the opportunity at the beginning, but they more than made up for it.
Thank you so much, Robert, for all of these very nice and very, very important points that you made. And thank all of you for being here today. Thank you for all of your contributions. For all the participants here today, you will have the chance to ask questions later on at the end of the seminar during our Q&A, during our live Q&A, and there will also be questions taken from the polls. Until then, the next step that we have is something that you've probably all been waiting for. You've heard a lot about the input that has been given to the EPI app. So now let's have a look at how it looks like. And for a prototype, Sonia, the floor is yours.